Welcome back. It is 12:23 in your health today. High blood pressure is such a common condition that many people just don't take it seriously, but you obviously should. We are joined by Dr. Lowell Steen from Loyola University Medicine to talk about some of the myths that come with high blood pressure. Thanks for coming in today. We appreciate it.
It's my pleasure.
There are quite a few myths to discuss, so let's get right into this. And one of them is a lot of people might say, I am too young to have high blood pressure. That only affects older people, but that's not the case.
Correct. It's true that blood pressure increases with age, but in fact, 1 out of 5 young adults will have hypertension or high blood pressure.
And that can be caused by a myriad of things.
Correct.
And so what is the most common thing that we find in young people that might result in high blood pressure?
Well, often in young people who are healthy, it's just a genetic predisposition, meaning, as my dad used to say, you can't pick your parents.
Right. Okay. Now, the next number 2 myth is, if I have an active lifestyle and I eat really well, I'm not going to get high blood pressure. But we kind of just touched on that a little bit. That's not the case either.
That's correct.
Mm-hmm.
I mean, I have plenty of patients who do everything right. They're good citizens. They eat well, and yet they have very high blood pressure. And that's where the genetic predisposition comes in.
Yeah, which is really, brings us to the question, can you do something about a genetic predisposition? And we'll get to that in a minute, but I want to get to myth number 3, which is, I can't have high blood pressure because I don't feel sick. I feel pretty good.
Right. This is the hardest thing for physicians because it's hard to have someone take medicines and seek help for high blood pressure if they're not feeling anything. And that's why we call it or refer to it as the silent killer, because you do often feel well and sometimes you feel worse on the medicines.
And the reality is most people don't take their blood pressure at home. Most people don't, unless you have high blood pressure and you're being told to do that, which is probably why those annual visits are so important, right? Because it is a silent killer, and if you're not paying attention to it, that's not good.
It's very true, and it's very important to take it at home because often it is high in the doctor's office. You're very anxious, and it's good to take it at home.
Yeah, and so you do recommend people try it at home, to take it at home.
Absolutely.
When they're calm and don't have, is it white coat syndrome? Is that what it's called, right? When
Correct.
you're nervous in the doctor's office.
Correct.
Okay. Number 4 myth, women don't have to worry about high blood pressure because it's more likely to happen to men.
Correct. It's true men and women have equal risk of developing hypertension. However, after menopause, women will actually have more high blood pressure than men.
And that's because?
It may be from estrogen, but women don't age as well in terms of blood pressure, as it turns out.
Okay, we may not age as well in terms of blood pressure, but I recently went to a reunion and we look a lot better. That's a whole other story, right?
For sure.
Okay, so myth number 5, if I have high blood pressure, the only solution is prescription drugs. And this is really important because some people don't want to get on high blood pressure medication because of the side effects. So do you have to? No,
you don't have to. Some people can get away with just diet and exercise. Salt plays a huge role in it. Stress techniques, often people will switch jobs, have a less stressful job, and their blood pressure goes down. There's also alternative products that are healthy, like pomegranate, hibiscus, beetroot, magnesium. All these things lower the blood pressure. I have a patient who basically put all these products in one beverage called 120 Life, and it's a nice way to get everything you need, and it can help promote low blood pressure.
But I have to ask you, so let's say my doctor says you have high blood pressure and I don't want to take the medication, so I could work with you and it would be a period of time where you'd say, well, maybe let's try this before we go on the medication, but that time has an end limit to it, doesn't it?
Correct.
Yeah.
Correct. And the converse occurs too. We can start the medicines to control the blood pressure and then introduce techniques that can lower it so we can drop your blood pressure amount. And
then finally, there have been concerns about some high blood pressure medications that contain a certain ingredient that supposedly has been linked to cancer. Tell everybody what that is, and what do you want to say to people who are saying, I'm not taking this anymore?
Right. Well, as any controversy like this, there's a lot of press about it, and the drug was valsartan. It's a very common blood pressure medicine, and there were 3 manufacturers of valsartan that part of the packaging of the pill contained a potential carcinogen. And so there's only 3 manufacturers that did that. So what I would advise patients, you can be switched. There are plenty of alternatives. And 2, consult with your pharmacist to see what the manufacturer was of that product. Okay, very good. So under a doctor's supervision, you can figure out how to make this work for your personal, health. Correct. Okay, great. Thank you, Dr. Lowell Steen. So nice to meet you. We appreciate you coming in today. Good advice when it comes to a very common problem that a lot of people have.